I'm Peter Doherty. I'm a professor at the University of Melbourne in Australia, and I've worked for decades on viruses and immunity. My colleague Rolf Zinckernagel and I were awarded the Nobel Prize in 1996 for our work on cellular immunity, which has been my specific interest since then. COVID-19 is an international catastrophe in many ways. It's causing enormous societal damage and enormous economic damage, more so in some countries than others. But I think we need to understand, this is a coronavirus, okay? Now, before the year 2000, there were 2 coronaviruses circulating in human populations. We'd known about them for a long time. They were in the group of viruses that causes seasonal respiratory infections, common colds, croup in little kids, and so forth. Now, and there are hundreds of viruses like that, but there were 2 coronaviruses in that mix. Now, since the year 2000, we have had 5 coronaviruses cross over, probably from bats, maybe through an intermediate species, into human beings. You experienced the first SARS virus in China. We didn't get that. It didn't get as far as Australia, but it was distributed in East Asia and it got to Toronto. And then we have the Middle Eastern respiratory syncytial virus, started in the Middle East. Probably someone got infected, a bat infected a dromedary camel, and maybe someone who races camels kissed the camel. They do kiss their camels, and contracted it. And we have a disease which is still spreading, highly lethal. The MERS virus came across in 2013, I think it was, and it kills about 30% of people and infects. But fortunately, it is not as infectious as SARS-CoV-2, the COVID-19 virus. So there are those 2 viruses that have remained in the sort of Europe-Asia thing, except for the original SARS getting to Toronto. And that original virus is burnt out. But the other 4 viruses are still circulating. And among those viruses, apart from COVID-19 and SARS-CoV-2, there are 2 common cold viruses, came across in 2004, one in the Netherlands, one in Hong Kong, and they are now global infections in human beings. So what is this telling us? What it's telling us is that with the change in economic circumstances, particularly in Asia, with the massive ramp up of international air travel by very large numbers of people, we are at major risk of further pandemics. And we need to use COVID-19 and this experience as a learning exercise. And we need to study it very, very carefully and get global agreements on things that need to be done. And one of them would, of course, be stopping the planes very early on. We didn't do that because the whole of the viral immunity community was thinking in terms of the influenza mantra. And that mantra, I've been involved in influenza research for years, is that you cannot stop a respiratory pathogen like flu by stopping the planes, but you can. We've stopped COVID-19 in Australia and New Zealand. We're island states, so we're better able to do that, but we stopped the plane. So that's one of the things we need to think about. The other thing we need to think about is that vaccines and monoclonal antibodies and all these wonderful things that we develop with our technology, and it takes us about a year to do that. Not to make the product, we can make that very, very fast, but to test it, to make sure that it's safe. And that's why it's taken so long to get the vaccines out. But what we could have done is develop antiviral drugs, because we've got antiviral drugs that hit all influenza viruses. We've got antiviral drugs that hit all the AIDS-type retroviruses. We should have been making antiviral drugs that hit all the coronaviruses and the couple of other types of viruses that are out there, in bats particularly, that could cross over into us. So I think there are things we should do. We should not think this is going to be the last pandemic for 100 years. We're going to be confronting these issues much more regularly if we go back to our practices before this happened.